Hi there.
Hi.
My name's Whitney. Nice to meet you.
Hi.
I heard you're not feeling too good.
Oh, I feel terrible.
Tell me what's been going on.
Oh, Chelsea, here we go again. Another round of respiratory season here where we are going to decide if this is a virus or bacteria.
I bet it's gonna be a virus, and then they'll give the patient antibiotics and it won't do any good.
No, they know better than that. They know if it's a bacterial, what antibiotic to use to kill me.
I won't be killed by an antibiotic. I'm only killed by resting fluids.
I hope it's a virus. I hope it's you.
All right. Well, sounds like, you're feeling pretty rough. Why don't we do an exam here? We'll see how everything's looking, and then we can decide what, if any, tests we need to run. Sound good?
Sounds really good.
Okay.
Oh, Chelsea, this is going to be a close call. I am not sure. What do you think it's going to be? If it's bacterial, what are those implications? Why is it such a big deal if we give that antibiotic?
If it's bacterial, they definitely need that antibiotic. But if it's a virus, then we could be not even treating what's causing it. We could be just making resistance worse.
Virus, virus, virus,
Virus.
virus,
I hope
virus,
it's a virus, too.
virus.
I'm the super bug.
Oh
I love antibiotics.
no! You love antibiotics. Why?
He's giving you the wrong antibiotic.
Yeah, you don't take your antibiotics like you're supposed to, or they give you the wrong kind.
Oh
and
no, super
I
bug.
get bigger and stronger, and
I have nightmares about you.
my superpowers with you. Come on, provider. Right there. That's the one we want. Yeah.
Looks delicious.
Ooh, speaking of superbug, ooh, that does not look like something we'd want to have.
No, not at all.
To prevent these, it would mean that we don't want to prescribe antibiotics as often as we have been. So what kind of infections would we want to have an antibiotic for?
So for some antibiotics, you would treat strep throat, urinary tract infection, whooping cough. Those are all things caused by a bacteria.
Because I definitely don't want to be getting one of those super bugs that just floated by.
Not at all.
This is likely a viral illness. Generally, will cause that congestion, scratchy sore throat, ear pains, some body aches and chills can be very common for that. For those, we generally just do some symptomatic treatment. Tylenol and ibuprofen is needed for either fever or body aches, okay? You can rotate those. Lots of fluids. Stay real hydrated. We want to keep all those secretions really thin so they're easier to kind of cough up or blow out if you need to. You can use, if you're feeling stuffy, nasal sprays or some humidification in your room can be really helpful for that too.
They're all going to get better.
It's real sad.
Providers are going to take good care of them.
So much for us.
All right, Kaylee, so what do you think we've learned today? What's the biggest important information?
Well, from what we've seen here with the provider who did an excellent job, it is likely a virus. But, sometimes we do have those bacterial infections. And if we do have a bacterial infection, it would be appropriate to do the antibiotic. We can do all sorts of testing, so lab is a huge piece of what we do here.
Yes.
We can do culture sensitivities to make sure that we are targeting the correct bug with our antibiotics, because we want to use the narrowest spectrum antibiotic. So those are really important pieces to the healthcare system, is making sure that our lab is involved with our cultures. We can do a throat swab to see if we have strep throat, and then urine cultures to see about urinary tract infections, sinus infections. That's pretty much based on provider assessment.
Yep, and depending on what your test shows, it may take a little bit, and you may have to change your antibiotic.
Yeah, that's true.
But
cultures can take a couple of days, so it wouldn't be extremely out of the ordinary for your provider to contact you and say that we need to change the antibiotic because the one that we picked out isn't sensitive enough to treat your particular bacterial infection.
you want to make sure you're taking it all. You don't want to miss any doses. You don't want to take your family's antibiotics. Take the one that you're actually prescribed.
If it asks you to take it with food, or if there's certain timing restrictions, that sort of thing, make sure that you're listening to all the instructions. All of them should be on the labeled portion of the bottle that you have, and then also when you go to pick it up from the pharmacy, they'll be sure to educate you there.
Yes.
A lot of times your provider is going to send you home with an after visit summary that's going to outline all of those key takeaways as well.
And there are sometimes drug interactions, so your pharmacist will let you know of that as well.
Yep.